Imagine a simple white vegetable sitting quietly in the produce section of a market. Most people walk past it without thinking twice. Yet inside that compact head of cauliflower is a remarkable collection of natural compounds that scientists have been studying for decades. These compounds influence inflammation, detoxification pathways, immune responses, and even the way our cells handle damaged DNA. Nutrition researchers now consider cauliflower one of the most biologically active vegetables in the human diet. It belongs to a family of vegetables that consistently appear in large population studies showing lower risks of cardiovascular disease and several forms of cancer. What makes cauliflower even more interesting is that how you chop it, cook it, and combine it with other foods can dramatically change the amount of beneficial compounds your body absorbs. Today we will take a careful and evidence-based look at cauliflower. We will explore its history, chemistry, nutritional value, and what human clinical research actually says about its effects on the body. We will also discuss the best ways to eat it, how much to consume, and when caution is necessary. Botanical and historical background. Cauliflower is scientifically known as Brassica oleracea var. Botrytis. It belongs to the Brassicaceae family, often called cruciferous vegetables. Other members of this family include broccoli, cabbage, kale, and Brussels sprouts. These vegetables share a similar biochemical defense system that produces sulfur-containing compounds when their tissues are damaged. These compounds are responsible for the distinctive smell and many of the health effects scientists study today. The earliest cultivation of cauliflower is believed to have occurred in the eastern Mediterranean region more than 2,000 years ago. Historical records show it was grown in regions of modern-day Turkey, Syria, and Cyprus before spreading across Europe. By the 16th century, cauliflower had become popular in Italy and France. Eventually it spread globally through trade and agriculture. Today it is widely cultivated across Asia, Europe, North America, and Africa. Several major varieties exist. White cauliflower, the most common variety worldwide. Orange cauliflower, rich in beta-carotene. Purple cauliflower, contains anthocyanin antioxidants. Green cauliflower, also called Romanesco, known for its spiral pattern and mild flavor. In traditional medicine systems, cruciferous vegetables were often used to support digestion and general health. Ancient herbal texts from Mediterranean regions described their use for purifying the blood, a concept that modern science now connects with detoxification enzymes activated by compounds in these plants. Bioactive compounds and chemistry. The true power of cauliflower lies in its bioactive phytochemicals. The most important groups include glucosinolates, isothiocyanates, indoles, flavonoids, phenolic acids. When cauliflower cells are broken through chopping or chewing, glucosinolates interact with an enzyme called myrosinase. This reaction produces compounds such as sulforaphane and indole 3-carbinol. These molecules have been widely studied for their ability to activate detoxification enzymes and influence gene expression involved in inflammation and cancer defense. One important point is that preparation method strongly affects these compounds. When cauliflower is chopped and allowed to sit for about 10 minutes before cooking, the enzyme myrosinase has time to convert glucosinolates into active compounds. If the vegetable is cooked immediately after cutting, the conversion is reduced. Heat also matters. Boiling cauliflower for long periods can destroy a large percentage of glucosinolates. Steaming, light sautéing, or roasting tends to preserve more of these beneficial compounds. Another interesting detail is that the body's gut bacteria can also convert glucosinolates into active metabolites. This means individuals with a diverse and healthy gut microbiome may absorb more benefits. Research from the National Cancer Institute highlights that sulforaphane activates antioxidant pathways such as the NRF2 pathway, which helps protect cells from oxidative damage. Nutritional profile. Cauliflower is surprisingly nutrient-dense while remaining very low in calories. A typical 1-cup serving of raw cauliflower contains approximately 25 calories, 5 grams of carbohydrates, 2 grams of fiber, 2 grams of protein. Very little fat. Despite the low calorie content, it provides several essential nutrients. Vitamin C, about 75% of daily needs per cup. Vitamin K, supports blood clotting and bone health. Folate, important for DNA synthesis. Vitamin B6, involved in metabolism and brain function. Potassium, helps regulate blood pressure. Magnesium, supports muscle and nerve function. Cauliflower also provides antioxidants such as glucosinolates, carotenoids, flavonoids. These compounds help neutralize free radicals and may reduce oxidative stress, which is linked to many chronic diseases. According to data compiled by the United States Department of Agriculture Nutrient Database, cauliflower offers one of the highest nutrient-to-calorie ratios among common vegetables. Evidence-based health effects. Cardiovascular health. First, let's look at the heart. Human studies show that a diet rich in cruciferous vegetables, including cauliflower, is linked to better heart health. A major study published in the British Journal of Nutrition found that women who ate more cruciferous vegetables had significantly less buildup of calcium in their arteries, which is a key marker for arterial stiffness and heart disease. This is likely due to the anti-inflammatory effects of sulforaphane, which helps keep blood vessels flexible and healthy. While it may not dramatically drop cholesterol on its own, it supports the overall system, helping to regulate blood pressure and reduce oxidative stress on the cardiovascular system. Similarly, a large population studies consistently show that people who eat more cruciferous vegetables tend to have lower risk of cardiovascular disease. A major prospective cohort study published in the Journal of the American Heart Association followed more than 68,000 women for 15 years. Higher intake of cruciferous vegetables was associated with reduced progression of arterial calcification. Researchers suggest that compounds like sulforaphane improve endothelial function and reduce oxidative stress in blood vessels. Another human clinical study published in Hypertension found that diets rich in cruciferous vegetables significantly improved vascular function compared with diets rich in other vegetables. The mechanism appears to involve nitric oxide production and improved arterial elasticity. Overall, cauliflower may support heart health by contributing fiber, potassium, and anti-inflammatory phytochemicals. Antimicrobial properties. Some compounds in cauliflower show antimicrobial activity in laboratory studies. Isothiocyanates have demonstrated inhibitory effects against bacteria such as E. coli and Staphylococcus aureus in experimental settings. However, most evidence here comes from laboratory and animal studies rather than large human trials. Therefore, it is more accurate to say cauliflower compounds may support antimicrobial defense rather than act as a treatment. Anti-inflammatory and antioxidant effects. The anti-inflammatory and antioxidant mechanisms are where cauliflower truly shines. Chronic inflammation is a major driver of diseases such as diabetes, arthritis, heart disease, and neurodegeneration. Sulforaphane activates the NRF2 signaling pathway, which increases production of antioxidant enzymes such as glutathione. Think of NRF2 as the master regulator of your body's antioxidant defense system. Sulforaphane flips this switch, causing your own cells to produce a cascade of powerful antioxidant enzymes that neutralize harmful free radicals and quench inflammation. This isn't just theoretical, it's a proven mechanism supported by numerous human trials. Human intervention studies have shown that diets rich in cruciferous vegetables can reduce markers of oxidative stress. A randomized dietary trial published in the American Journal of Clinical Nutrition observed that individuals consuming cruciferous vegetables daily showed reduced inflammatory markers compared with control groups. These findings suggest cauliflower may help support the body's natural anti-inflammatory defense systems. Potential anti-cancer properties. This leads us to the potential anti-cancer properties, which is the most researched area. It is crucial to state up front, no food can treat cancer. However, the evidence for cancer prevention is compelling. Epidemiological studies consistently show that people who eat higher amounts of cruciferous vegetables have lower rates of certain cancers, particularly prostate, colorectal, lung, and breast cancer. The mechanism is twofold. First, the antioxidant and anti-inflammatory effects we just discussed help prevent DNA damage that can initiate cancer and induction of apoptosis in damaged cells. Second, compounds like indole, 3. Carbinol help your body metabolize and eliminate excess estrogen in a healthier way, which may reduce the risk of hormone-related cancers. Cruciferous vegetables are among the most studied foods in cancer prevention research. Population studies consistently show lower risk of certain cancers among individuals with higher intake of these vegetables. For example, a systematic review in the journal Annals of Oncology found that high intake of cruciferous vegetables was associated with reduced risk of lung, colorectal, and breast cancers. For purpose of emphasis, cauliflower does not treat cancer. The evidence supports a preventive or supportive dietary role rather than a therapeutic one. Immune system and respiratory health. Vitamin C plays a key role in immune function. A single serving of cauliflower provides a large portion of daily vitamin C needs. Vitamin C supports white blood cell activity and helps maintain skin and mucosal barriers against pathogens. Sulforaphane has also been studied for its potential role in respiratory health. Research published in Clinical Immunology found that sulforaphane can increase antioxidant enzymes in airway cells, which may help protect against environmental pollutants. Blood glucose regulation. Cauliflower has a low glycemic index and provides dietary fiber that slows carbohydrate absorption. Clinical nutrition studies show that high-fiber diets improve insulin sensitivity and glucose control. Because cauliflower contains very little digestible carbohydrate, it is commonly recommended as a substitute for refined grains in individuals managing diabetes or metabolic syndrome. Support for general body systems. In summary, for your general body system, cauliflower acts as a comprehensive support system, and regular consumption of cauliflower may support multiple body systems such as digestive health through fiber content, liver detoxification pathways through glucosinolates, brain health through antioxidant activity, bone health through vitamin K and magnesium. While these effects vary between individuals, they contribute to the overall value of cauliflower as a regular part of a balanced diet. It's not about targeting one organ, it's about providing your entire body with the tools it needs to function optimally. Optimal consumption practices. Recommended intake. Most nutritional research does not define a precise cauliflower dosage. Instead, studies focus on total cruciferous vegetable intake. Health organizations commonly recommend 3 to 5 servings of cruciferous vegetables per week. 1 serving equals about 1 cup raw cauliflower. Half a cup cooked cauliflower. Consuming a variety of cruciferous vegetables appears to provide the best protective effects. Raw versus cooked. Raw cauliflower gives you the maximum amount of active myrosinase, so you'll get the most sulforaphane from chewing it. However, cooking can make it easier to digest and its nutrients more available in other ways. The best approach is to have a mix. Enjoy it raw in salads or with dips. When you do cook it, remember the chop and wait method. Chop it, let it sit for 40 minutes, and then lightly steam, roast, or stir-fry it. Pairing cooked cauliflower with a source of active myrosinase, like a dash of mustard powder or some raw radish, can also help boost sulforaphane formation in the gut. Enhancing bioavailability. Certain preparation strategies may improve absorption. Chop cauliflower and allow it to rest for 10 minutes before cooking. Pair it with healthy fats such as olive oil to enhance absorption of fat-soluble compounds or add it to a salad with an oil-based dressing. Combine it with foods containing active myrosinase, such as mustard seeds or radish. These simple techniques can increase the availability of beneficial compounds. Supplements and extracts. For supplements, you'll find sulforaphane or broccoli extract supplements. While they can deliver a concentrated dose, whole food is always best because you get the synergistic effect of all the fiber, vitamins, and other compounds working together. If you do consider a supplement, it's a conversation to have with your doctor first. Safety and contraindications. Cauliflower is safe for most people when consumed as food. However, a few considerations exist. Drug interactions. The most significant interaction is with blood thinners, specifically warfarin, Coumadin. This is because cauliflower is high in vitamin K, which promotes blood clotting. If you are on warfarin, it's vital that you do not suddenly change how much cauliflower you eat. The key is consistency. Your doctor sets your warfarin dose based on your typical vitamin K intake. If you suddenly start eating a lot more or a lot less, it can affect your blood's clotting time. Always discuss dietary changes with your healthcare provider if you're on this medication. Digestive side effects. You might experience some mild side effects. Cauliflower is high in fiber and contains raffinose, a complex sugar that some people struggle to digest. If you're not used to a high-fiber diet, eating a large amount at once can cause bloating and gas. The best approach is to increase your intake gradually. Also, you may have noticed that eating cruciferous vegetables can cause a change in body or breath odor. This is due to the sulfur compounds we discussed earlier. It's completely harmless, though perhaps not ideal before a date. Thyroid considerations. Cruciferous vegetables contain compounds known as goitrogens, which can interfere with iodine uptake when consumed in extremely large amounts. For individuals with normal iodine intake, moderate consumption does not appear to cause thyroid problems. Cooking also reduces goitrogen levels. Surgery and medical conditions. Because vitamin K affects blood clotting, individuals preparing for surgery are sometimes advised to maintain stable intake of vitamin K-rich foods. Pregnant and breastfeeding women can safely consume cauliflower as part of a balanced diet, although concentrated extracts should only be used with medical guidance. For the general population, including those with bleeding disorders, it's not about avoiding cauliflower, but about maintaining a consistent, moderate intake. Supplements. If you choose to go the supplement route, be aware that the market is not strictly regulated. The quality and potency of supplements can vary wildly between brands. Look for supplements that are standardized to a specific amount of sulforaphane or its precursor, glucoraphanin. Again, this is something to research thoroughly and discuss with a healthcare professional. Conclusion. So, from a bland, overlooked vegetable to a scientifically backed superfood, cauliflower has earned its place in the spotlight. It's a humble crucifer that offers a powerful combination of fiber, vitamins, and unique bioactive compounds that support your heart, fight inflammation at a cellular level, and help your body protect itself. By understanding how to prepare it. Like the simple, chop and wait method, you can maximize these incredible benefits. Final thoughts. Cauliflower may look simple, but scientifically it is a very complex food. It provides essential nutrients, fiber, and powerful plant compounds that interact with the body's antioxidant systems, detoxification pathways, and inflammatory responses. Human research suggests that regular consumption of cruciferous vegetables like cauliflower may support cardiovascular health, metabolic function, immune defense, and long-term disease prevention. The key is consistency. Eating cauliflower as part of a varied, plant-rich diet appears far more beneficial than relying on supplements or occasional large servings. Simple habits such as lightly steaming it, pairing it with healthy fats, and combining it with other vegetables can significantly improve its nutritional impact. If you found this deep scientific breakdown helpful, take a moment to support the channel. Subscribe for more evidence-based nutrition insights, like this video, share it with someone interested in improving their health naturally, and follow our page so you never miss the next research-backed nutrition guide.